Good morning, good afternoon, good evening, everybody. And thank you so much for joining us today. We have an exciting agenda. Next slide, please. As you know, we will be looking at the role of gender-responsive social protection and how it can support, address some of the underlying drivers of child marriage here in the region. We will be having two countries that have been making incredible efforts share their experiences. Next slide, please. So before we enter into the webinar, just a reminder of some housekeeping guidance. This session will be recorded, as many of you know, and it will be available on socialprotection.org with also all of the presentations. We have closed captions. You just need to click the button that's CC closed captions. And we will have interpretation for one of our speakers that is joining us from Bangla to English. Next slide, please. So we have a packed agenda with first we will have this introduction. We will go straight into a framing where we will be listening to the overview of the state of child marriage. We will then go into have the honor to have a young advocate sharing her work in preventing child marriage. And then we will have a quick overview of the role of gender-responsive social protection. We will then go into the crux of this webinar and talk about, present 4 case studies, country experiences from Nepal and from India. And then we hope to have a few moments for questions and answers before we close. As you know, probably there is a chat box, so we encourage you to please present yourself, please contribute to the discussions, share links, share your reflections. And then if you do have questions, we do encourage you to put them in the Q&A box. Do include your name and organization and for whom the question is. And we will try to respond to questions in real time, as well as include some of them to be answered during the questions and answer session at the end. And of course, interact with us on social media. Just a reminder that this is a safe space. Very important for us as UNICEF that we're following safeguarding guidelines. So please do remember that to be the most constructive discussion, we do encourage respect and trust among each other. Next, please. We have an incredible lineup of speakers, and I will not go into all of the speakers at the moment, but just to say that we have both practitioners, we have a youth advocate, we have government officials that are taking the time to join and share their experiences from across the region. And we'll be moderating, next slide, please. From me, myself, and also Shreyasha, who is my co-host here. And we will also have an incredible translator supporting us with interpretation. Please note that there will be in the slide deck on the socialprotection.org webinar site, you will find all of the bios of each one of these incredible speakers and practitioners. So please do take the time to look through them because they do have a rich experience. Next slide, please. So now we will immediately jump into the first presentation, which is the first part of the framing section of this webinar. We will turn to Vedasto, who is our regional advisor for child protection here at UNICEF South Asia, who will give us a brief overview. Over to you, Vedasto.
Thank you very much, Jessica, and good morning, good afternoon, colleagues. As Jessica said, I'll give you a quick overview on child marriage agenda across the region. And child marriage basically is a form of violence against children and violence against human rights because it limits the girls to reach their full potential. And as you know, children who are married before 18 are more likely to suffer from intimate partners' violence and include sexual, physical, or psychological and emotional violence. But most important, we need to note that SDG on ending child marriage, SDG 5.3 and SDG 16.2 are crucially interlinked. You can't eliminate violence without eliminating the other. So just to go through the slide number 2, please. Globally, as you know, the statistic tells us that 640 million girls and women alive today were married in childhood. And our region, South Asia, accounts for nearly half the global total of child brides. If you look at that presentation, if you look at the purple color, you could see that South Asia, it incorporates 290 million children, and of course, Sub-Saharan Africa and others follow. But if you look at that statistics, and with the fact that South Asia continued to drive globally reduction of child marriage, 1 in 4 young women aged 20 to 24 were still married before 18 years. And while disparities are evident not only between countries, but also within them, within countries, you'll see that there is serious disparities. And you will see in the next slide the example in Afghanistan and other countries. These disparities are exacerbated by different factors, such as poverty, castes, urban-rural divides, social and gender norms, and humanitarian crises. But apart from those factors, there are other major challenges like climate crisis, economic shocks. We have fallout of coming from COVID-19, which are threatening to reverse hard-earned gains from South Asia, where we are, of course, doing fine, although we still have a long way to go. Next slide. Okay, in this next slide, we'll look at the disparities. As I said before, that the level of child marriage vary considerably across the region, from over 50% in Bangladesh to 2% in Maldives. And within countries, there's a further disparity. For example, in Afghanistan, there's a 10-fold difference in prevalence across the provinces. And with the challenges in Afghanistan, it makes it even more complicated. If you look at the presentation there, you'll see the difference that we have 51% prevalence in Bangladesh, while we have 2% in Maldives. And of course, we have other countries like Nepal. Most recent data shows that there is a kind of an increase to 35%, but also you have other countries like Bhutan, where the data shows that there is decrease to single digit. But this is the global, regional picture, which shows that there is a huge disparities and we still have a long way to go. Next slide, please. These slides actually show a percentage of women who were first married or in union before age 18 by education, wealth quintile, and the residence. Child brides in South Asia are more likely to live in poor households where they have less education and reside in rural areas. Therefore, child marriage and poverty are closely connected in South Asia, where economic hardship leads families to see child marriage as a coping mechanism. However, this is different, and this relationship is not always straightforward, as a significant number of child brides comes from wealthier families, as shown in data from countries like Bangladesh. If you look at wealthy quintiles, Bangladesh and the Nepal, it's not that you can see the difference that children who are coming from wealthy quintiles also are also affected with this crisis. In terms of education and access to quality education and decent work are very critical to breaking the cycle of poverty and the intergenerational transmission of child marriage as well. So we'll see details as we go through the presentation. Another slide. This slide is acceleration of current progress. And as you are aware, we are currently off track in achieving SDG by 2030. Of course, only Maldives in the region is on track to eliminate child marriage. And we are told unless we end child marriage, we will not achieve at least other 9 SDG, including poverty, food security, health, education, gender equality, and others. If you look at this last slide, in 1997, we were at 60%. We did have fast decline from 1997 up to 2022. But evidence tells us that if we want to eliminate this, of course, progress of the past 2025, if we go with progress of the past 25 years ago, will be by 2050, we'll have 10% decline. If we go with progress of the past 10 years, then we will have 5% of reduction. But if we go with the progress of the past 10 years, and if we double the progress of the past 10 years, then by 2050, we'll have 1% reduction. So you can see that this is unfinished agenda, and we have a serious agenda to eliminate child marriage. So I'll stop here, and I'll let Jessica take us up to another session. Thank you very much.
Thank you so much, Vedasto, for giving us this quick overview. This has been really helpful, and we see that we still have quite a challenge to go forward. So now we turn to our youth advocate, Fabiha Janat, who is a passionate youth advocate and who has served as a peer leader at UNICEF Child Protection Hub since 2019 and has been actively putting efforts to prevent child marriage in her community in Bangladesh. So I'll ask Fabiha to come on screen, and we will have translation from Nusrat, who is going to be translating for her. Over to you, Fabiha.
Hello, everyone.
Hi, Fabiha. You can also put your video on if you want. Thank you so much.
Hello, everyone. My name is Fabiha. I am 19 years old. I studied honors first year. So প্রথমে আমি উল্লেখ করতে চাই যে আমি চাইল্ড ম্যারেজ ইয়ুথ অ্যাডভোকেট হিসেবে কাজ করতে অনুপ্রাণিত হয়েছি 2018 সাল থেকে। তখন আমি ক্লাস 8-এ পড়তাম। আমার ক্লাসের আমার একজন ফ্রেন্ড ছিল, তার নাম ছিল সুমাইয়া। ক্লাস 8-এ থাকা অবস্থাতেই তার বিয়ে হয়ে যায় এবং সে তার বাচ্চা হওয়ার সময় মারা যায়। সেই জায়গা থেকেই সেই হৃদয় বিদারক ঘটনাটি থেকে আমি আসলে সিদ্ধান্ত নিই যে আমি একজন ইয়ুথ অ্যাডভোকেট হিসেবে কাজ করব। আমি 2019 সাল থেকে প্রথম ইউনিসেফের দায়িত্বে থাকা একটি হাবে পিয়ার লিডার হিসেবে যুক্ত হই এবং 2022 সাল থেকে 8টি বিয়ে বন্ধ করতে আমি আমার হাবে সক্রিয়ভাবে কাজ করেছি। এবং সবচেয়ে খুশির ব্যাপার হচ্ছে এটা, 8টি মেয়ের মধ্যে সবাই এখন পড়াশোনা করছে। তাই আমার ইচ্ছা আমি ভবিষ্যতে এরকম দুর্বল কিশোরীদের জন্য আরো কাজ চালিয়ে যাব।
Hi everyone. This is Turna. So I will be providing translation support to Fabiha's story. So let me start. So at first, I'm translating in the first person. So I'll be translating as she said. First of all, I would like to share what inspired me to become a youth advocate against child marriage. So in 2019, while I was studying in grade 8, my friend Sumaya was forced into marriage at a young age. Tragically, she lost her life during childbirth. And this heartbreaking experience stayed with me. And from that moment on, I resolved to work as a youth advocate to help end child marriage. I joined UNICEF in 2019 as a peer leader in a child protection hub. Since 2022, I have actively worked within my community to prevent child marriage, successfully stopping 8 cases so far. I'm happy to share that all 8 girls are continuing their studies now, and I am committed to supporting vulnerable girls in the future and working toward ending child marriage.
আমি যে 8টি বিয়ে বন্ধ করছি তার মধ্যে একটি ঘটনা আমার এখনো খুব মনে পড়ে। প্রথমে আমি তাকে হাবে দেখে বুঝতে পারি যে তার মন খারাপ। তো তখন আমি তাকে জিজ্ঞাসা করলাম তোমার সমস্যা কি? তখন সে আমাকে বলল যে তার বিয়ে ঠিক হয়েছে। তখন আমি তাকে বললাম ঠিক আছে, তুমি চিন্তা করো না, আমি দেখছি। তারপর আমি আমার ক্লাবের কমিউনিটি ফ্যাসিলিটেটরকে নিয়ে তার বাবা মায়ের কাছে যাই এবং তার বাবা মাকে বুঝাই যে তার তো বিয়ের বয়স হয়নি, তাকে কিভাবে বিয়ে দিবেন। তখন তারা আমাদেরকে বলল যে তার বিয়ের বয়স হয়েছে দেখেই আমরা তাকে বিয়ে দিতে চেয়েছি। তখন তারা আমাদের কথায় রাজি হয়নি। তারা তাদের মেয়েকে বিয়ে দিতে চায়। তখন আমি এবং আমার কমিউনিটি ফ্যাসিলিটেটর মিলে আমার ক্লাবের চাইল্ড রাইটস ফ্যাসিলিটেটরকে জানাই এবং তিনি এবং কমিউনিটি ফ্যাসিলিটেটর মিলে তার বাবা মাকে বুঝায়। তারপরও তার বাবা মা বুঝে না, তাদের মেয়েকে তারা বিয়ে দিতে চায়। তখন অ্যাজ পিয়ার লিডার হিসেবে আমি আমাদের ওই শিশু সুরক্ষা হেল্পলাইন 109-এ ফোন করি এবং স্থানীয় প্রশাসন সহ সকলের সাহায্য নেই বা এই বিয়েটি বন্ধ করার জন্য। তাছাড়া আমাদের হোয়াটসঅ্যাপ গ্রুপ থাকতো, যেটার মাধ্যমে আমরা সম্মিলিতভাবে বাল্যবিয়ে বন্ধ করতে সক্ষম হই। তাছাড়া আমার বাবা মা আমাকে এই ধরনের কাজে অনেক সাহায্য করে। তাই সব মিলে আমার আত্মবিশ্বাস আরো বেড়ে গেছে।
ফাবিহা, একটু তোমার ক্যামেরাটা অন করবা? সবাই তোমাকে দেখতে চাচ্ছে। And then continue. Fabiha?
I think we may have lost Fabiha. So maybe do you want to translate what she said in the last part? And then, oh, no, she's here.
Yeah, she's here. Yeah. ফাবিহা, বলো তুমি যে পর্যন্ত বলছিল এখান থেকে কন্টিনিউ করো।
জি। তাছাড়া আমাদের হোয়াটসঅ্যাপ গ্রুপ আছে, যেটার মাধ্যমে আমরা বাল্যবিয়ে বন্ধ করতে সক্ষম হই। তাছাড়া আমার মা বাবা আমাকে এই ধরনের কাজে অনেক সাহস যোগায়, তাই আমার আত্মবিশ্বাস আরো বেড়ে গেছে। তাছাড়া বিয়ে বন্ধ করার পর কিছু ক্ষতিকর প্রভাব পড়তো। ওরা আমাকে কলেজে যাওয়ার পথে হুমকি দিত, আমাকে এবং স্থানীয় চেয়ারম্যানকে বলে দিত পিয়ার লিডারদের মোবিলিটি বন্ধ করে দিতে, হাবগুলা বন্ধ করে দিতে। এবং তারা আমাদের হুমকি দিত বলে আমরা চলাফেরা করতাম অ্যাডolescence ফোর্স নিয়ে, যেটা আমাকে অলওয়েজ প্রোটেকশন করতো। তাছাড়া আমাদের হাবে সিআরএফ, সিএফ এবং স্থানীয় প্রশাসন সহ সকলের মিটিং হতো, সেটাও আমাকে অলওয়েজ প্রোটেক্ট করতো।
So one of the 8 cases of which I prevented the child marriages stand out to me. So one day I noticed a young girl looking distressed in our child protection hub, and I asked her if something was wrong. She hesitated before finally confiding that her family had arranged her marriage. I reassured her that we would look into it and involved our community facilitator to approach her parents. Together, we explained that she was too young to marry, hoping they would see our concerns. However, they remained adamant and they insisted that she was of marriageable age. Then we sought support from our child rights facilitator to counsel her parents, but even then, they were unwilling to change their minds. As a last resort, I called the government's Child Protection Helpline 109 as a peer leader, and with help from the local administration and from community leaders, we managed to prevent the marriage. We created a WhatsApp group to alert each other about cases of child marriages, which has helped us work together and intervene faster. And my parents are incredibly supportive, and this, along with other collaborative efforts, has strengthened my confidence in fighting child marriage. However, our actions are not without risks. After stopping some child marriages, I faced threats on my way to college, and there were calls to shut down our hub, to halt our advocacy. We had to work with members of our youth group for safety, and frequent meetings were held with our child rights facilitator, our community facilitator, social workers, and local authorities to ensure our protection.
তাছাড়া বাংলাদেশে এখনকার সময়ে বাল্যবিয়ের হার অনেক বেশি, যেটা প্রতিনিয়ত বেড়েই চলছে। তাই বাল্যবিয়ে বন্ধ করা উচিত, কারণ তা না হলে কিশোর কিশোরীদের শারীরিক ও মানসিক স্বাস্থ্য ঝুঁকি, শিক্ষা থেকে বঞ্চিত, ব্যক্তি স্বাধীনতার ক্ষতি, দরিদ্র ও আর্থিক নির্ভরতা সহ বিভিন্ন প্রকার সমস্যার সম্মুখীন হতে হবে। তাছাড়া আমার মনে হয় প্রতিটি বাল্যবিয়ে বন্ধ করা মানে আমাদের মেয়েদের এবং সমাজের উজ্জ্বল ভবিষ্যতের দিকে এক ধাপ এগিয়ে যাওয়া। তবে আমার মতামতের ভিত্তিতে আমার মনে হয় সমস্ত শীর্ষ অভিনেতা, ইউনিসেফ, সোশ্যাল ওয়ার্ক করে এ ধরনের যতগুলো সংস্থা আছে এবং সরকার সহ সকলের এগিয়ে আসা, বিশেষ করে এরকম ঝুঁকিতে থাকা দুর্বল কিশোর কিশোরী ও শিশুদের পাশে দাঁড়ানো, যাতে আমরা তাদেরকে নিজেদের পরিবর্তনের নেতৃত্বদাতা হিসেবে গড়ে তুলতে পারি এবং আগামী প্রজন্মের জন্য একটি নতুন বিশ্ব তৈরি করতে পারি।
Today, the rate of child marriage in Bangladesh is really high, and it continues to rise. Bangladesh has one of the highest rates of child marriages in the world, making it all the more critical that we stop it. Without intervention, countless girls will face profound challenges, including physical and mental health risks, lack of education, loss of personal freedom, poverty, and financial independence. Each child marriage prevented is a step toward a safer and healthier future for our girls and communities. So looking back, I strongly believe that all child protection agents, including UNICEF, social workers, community organizations, and government bodies, should stand with vulnerable adolescents. And together, we can empower young people as leaders of change, building a safer and brighter future for generations to come. Thank you. Over to you, Jessica.
Thank you so much, Fabiha, for sharing your story and your experience and highlighting the importance of this peer support as well as empowerment. So we are really grateful, and I see that in the chat, we also see that it's very inspiring. And as we now turn to the last presentation in this section on the framing, we are looking at one of the instruments that can also support gender equality. So I will be presenting. Let me just share my slides. So I will be presenting very briefly an overview of why social protection is so important in addressing, in advancing gender outcomes here in South Asia. We will look at a few recent publications with evidence on the impacts of social protection on gender equality, and then we will dive into how can social protection address some of the drivers of child marriage. And finally, we'll close with some inklings of what are the important design and implementation features as we try to leverage social protection to be able to address some of the drivers of child marriage. Now, we just as a reminder for all of us, I think we all know social protection is a fundamental human right. And as such, it's about establishing these foundations, what we call social protection floors, which enable everybody across their life cycle to access health services as well as income security. And the main aim of it is really to ensure that everyone has an adequate standard of living and do not fall into poverty. We know that in the region at the moment, although there has been much progress, there is still gender equality. And as you can see from these different graphs, that these are both found outside and inside of the household, and that they shape the future opportunities and outcomes of girls and women. Now, because of this, it's so important to address some of the gender risks and vulnerabilities that women and girls face across the life cycle. And you can see these types of risks nicely depicted in the graph on the right, which is from one of the latest STAR publications. Because if we leave these unaddressed, we know that these can become barriers for women and girls to the realization of their rights to education, to health, to nutrition, to decent work, and can foster greater income insecurity and poverty among women and girls. So when we talk about gender responsive social protection and aim for gender transformative social protection, we are talking about, we're trying to promote a rights-based approach that empowers every individual within the household, including women and girls, and that promotes solidarity between gender, income, and age groups. So what does the evidence tell us so far? We have some recent publications that are showing that social protection has a positive impact on economic security, improves access to health and education for girls and women, and reduces violence. There is still more mixed evidence. For instance, we know that there has not been much evidence to show that it has helped decision-making power or decision-making, redistribution of decision-making within the household. And we do see still some programs that tend to increase the time burden, especially on women and girls, because they replicate traditional norms of caregivers that shift the responsibility on women. So overall, however, what we can see from this is that there is a transformative potential of social protection when gender needs are taken into account. So as we take this, we look forward to see how can we use social protection and these impacts to see how we can address some of the drivers of child marriage. And in this slide, what you can see is on one side, you see the drivers of child marriage. As Vedasto was sharing, it is quite complex. It is not uniform. It depends on the country. I will just highlight a few, for instance, poverty. And although we've seen incredible progress over the last 20 years here in the region, we still see that poverty and deprivation remains, especially among young women and girls. Recent estimates, for instance, from the UN Women Report, shows that 12% of girls between 15 and 24 live in poor households compared to 6% of boys. We also know that there are high levels of out-of-school children, particularly in, for example, in secondary education. And we've seen already from Fabiha's recounting of her experience how this has related to child marriage. And we also know that this region is prone to or vulnerable to different crises, particularly climate change and shocks. So all of these are some of the drivers that social protection has a potential to have an impact, for instance, in reducing poverty, monetary poverty and inequality, in supporting greater access to education, and in building resilience of women and girls who are often most affected by the different shocks. Now, how do we harness this social protection? So first, one of the key points to bear in mind is that within South Africa, we have some of the highest, the most largest social protection programs in the world. For example, the BISP in Pakistan, or PDS here in India, or the NREGA. And with that, we have an opportunity to identify girls at risk, because many of these programs also reach a lot of the more vulnerable groups. And we have an opportunity to leverage social protection as a platform to be able to connect these girls and women to other services that may help them address the drivers of child marriage. And finally, we also know that having robust, large-scale social protection systems help us be able to respond more quickly to these different shocks and build resilience within households and with women and girls. So, but however, we're important to remember that design must be intentional. So we need to think of the objectives already, and how we design it will depend on the outcomes, and hence also gender responsive. So what we're seeing in terms of design, that's two things that I would like to highlight from this slide, is first that more universal and unconditional programs have the potential of reaching more vulnerable groups than more conditional and more targeted programs. And this is particularly so in contexts such as where there's high levels of informality and vulnerability. And this is similar, for example, in many of our countries in South Asia. The second point that is important, because we will hear a lot of conditions, conditional cash transfer programs, that when we talk about designing programs with conditions, that they carry a risk. And that risk means that we may be penalizing those that are the most vulnerable, because those are the same people who have the most difficulty in being able to comply with those conditions and meet those conditions. The second part on the conditions that carries a risk is that we know that our aim is really, as we heard also from our youth advocate, is that we want them to be empowered. We want to create agency. And by imposing conditions, we defeat that purpose. And finally, just to remind ourselves that there's more and more evidence that shows that even unconditional cash transfers have similar impacts, and can, if designed in ways that support this, and through nudges, labeling, pacts between the beneficiary and the programs. Now, finally, as we saw and we heard, I think, from Vedasto, that it's a complex issue with many drivers. So we know that social protection alone cannot address all of the drivers of and vulnerabilities of girls and women, and particularly drivers of child marriage. So it's important to think of how do we connect it to wider interventions and sectoral and services. So here, the last point, and it will lead us to the next section, is that we are looking a lot more, and we see countries moving towards these cash plus approaches, which brings together different services and cash transfers and other social protection mechanisms, and to the same population, to be able to have a broader reach and a broader address better the different drivers of inequality. So I will stop here, and I will thank you all, and then we will go to our next section. And our next section is, we are now entering the moment where we will hear how different countries, Nepal and India, have been using these different cash social protection mechanisms and linking them to other services to be able to address some of these drivers of child marriage and gender inequality. So the first person I will call is Mr. Ananda Magar, who is the Secretary at the Office of the Chief Minister and Council of Ministers in Karnali Province. He will be presenting a program called Bank Kata Choriko Suraksha Jivan Variko that he's been leading the rollout. So over to you, Mr. Magar.
Good afternoon to everyone. I'm Ananda Saru from Nepal, Karnali Province. As we see in slide, this is gender responsive program features mainly due to we have highly early marriage problem, and we also facing the problem of early pregnancy rate also, and school dropout problem so high in Karnali province. and girl missing is also a problem. So we have to we have to we have we had launched a program bank khata choriko surecha jivan bhareko. This program means we raise a fund at bank account for the girls who were covered under this program. Uh, so by this program, we hope that we will overcome the problem. Next slide, please. Next slides. Please, next slide.
Mr. Magar, you are sharing your screen, so you just need to press the down arrow in your clip. You just click on your screen.
Now, are you seeing my presentation?
Yes, this is your presentation. So you just click in the arrow and then you go to the next slide. No?
Okay. It's not running.
All right, so I'll share my screen for you. Just 1 second.
Thank you. And on the मैले पनि सेयर गरिरहेको छु.
This one?
Yes. यहाँबाट सेयर गरेको अहिले बन्द गरिदिनु मलाई.
Mr. Magar, don't worry. Fabiana is sharing a screen, so you can now just let her know when to go to the next slides.
Okay. Okay. I'm representing my presentation. Under this program, we covered 10 districts of Karnali province, where 79 local governments and 33,387 girls have been enrolled under this program. And also budget allocated for this program. And by this program, positive citizens positive perception for the girls is increased, and early child marriage and pregnancy reducing. It helps us and encourage timely birth registration. Now Karnali province is high position for birth registration. And also this program helped to promote education completion of secondary level, and also the attitude perception is getting positive towards daughter, and shifting backward communities for positive perspective on girls child education is shifting of perspective and perception. And social provincial program, this program is recognizing as a social provincial program and popularly. Please, next slide. And we also now facing few challenges, especially in province, we are facing lacking of budget. So government wants to, the fund will flow for the infrastructure. So we are facing ensuring the timely budget allocation and release. And also we have especially we have program document, but we need to effective laws, basic laws for this program, and also we have also facing the migration problem. So daughter registration and birth registration. Migrant families also next challenge, and few registration like record keeping of the girls. Also, we are facing this problem, and we don't have uniformity in the access of bank facilities. So that also a challenge, and also uh, we have to handling program. We need to real time data. That's also uh, we need to improve, and also we have to need capacity building and for the local governments officials and beneficiaries, and especially we challenging the base of law, especially act. We need to act because this program is affected if effect effective for a long time, so we need basic rule law. Next, please. Next slide. Uh, we learned uh, so many things, so many lessons uh, after this program. So our government uh, announced the a policy document as a legal foundation. So we are now working for these laws, and also uh, we have to collect fund. We have to need fund for this program, and uh, uh, we have to uh, we have to mm, uh, make effective data system, management information system, and track for the project implementation system. And also, we have to develop supervisory structure and process for effective program oversight. And also, we are after launching this program, we missed 2 years of budget due to lacking of budget. So we have to need assuring the budget, and also we have to convincing the uh, all local governments for cooperating for partnership for this program. And also we also we mainly facing the ideal ideal level of this program, how we can link it this fund for productive sector. Please, next slide. uh, Mainly the government will uh, uh, we are now discussing it. It's under discussion. We are reformatting the program concept. So the government will issue the promissory note in the name of daughter immediately after her birth and raise fund. The fund will mature up to 20 years, and the daughter will receive the fund after completing few conditions like delay of age of marriage after reaching 20 years of age and complete higher secondary education. The government hoping that this fund will mobilize for the revenue generable sector, and also we are redesigning the program and will create win-win condition, helping to end child marriage, enhance the value of girl child in a society, help in the completion of the secondary education for girls, and fulfill the gap of block budget to invest in impactful infrastructure projects. uh, Thank you. Next slide, please. Especially after I think this program will help to achieve our goal to establish a society that holds gender equality So we are setting objective to contribute to the prevention of marriage for individual under 20 years of age, and to guarantee that female children have the opportunity to complete at least secondary education, to increase self-confidence of female students, to support initiative aimed and eradicating gender-based discrimination, violations, exploitation, and alter treatment. Uh, uh, few outcomes and achievements of this program is that we increase the number of rate of girl child birth registration records, and fetus identification will reduce the rate of abortion, significant reduction in child marriage, extend access to the to at least secondary education for girl, decrease discrimination between sons and daughter, reduction in negative thinking towards daughter. After the age 20 years, initial seed capital will provide to pursue work, enterprise, or further education. The provincial government can invest the fund of the daughter prosperity fund in the productive sector to raise resources for the strategic plan of the province. It means we will gain union position. Thank you.
Thank you so much,
Thank you.
Mr. Magar, for sharing this experience and being so candid with us, sharing some of the challenges that you face, but also the lessons that you learned. And also this need to, when we're looking at especially gender equality, that these are long-term programs that need long-term financing and gathering also the support of all of the local governments. So I think very insightful presentation. Thank you so much. We will now go to Miss Anita, who is a part of a consultant for the STAR facility, who has also been doing an assessment of the BPBB program in Nepal. And I let Anita come in. Please share your screen, and we're looking forward to hearing the experience.
Thank you very much, Jessica. Can you see the screen?
Yes, perfectly. Thank you so much.
Thank you. Good morning, good afternoon, everybody, based on where you are joining from. Thank you for your interest in the work, and thanks to Fabia, Jessica, Sriyasaji, and the team for this opportunity. I'm going to present on BPBB, Beti Padhao, the Beti Padhao, Beti Bachao program from Nepal. It's a social protection program targeted to girls in the Madhya province, one of our 7 provinces. The provincial government, but also with the support from organizations such as UNICEF and FCDO, is implementing this program. And the research work was led by STAR Facilities. For those of you who want to know more about STAR, Charlotte is there, and so is Bex. STAR is dedicated to expand and improve the effectiveness of investment, both in social protection approaches in crisis and also gender responsive social protection. It's funded by FCDO. So that is STAR. So I should first give you a brief background of the Madhya province, as Anand sir shared. For the Sudur Paschim province, Madhya province also has one of the largest gender gaps in terms of critical aspects of human well-being and development. As you can see in the table, for example, sex-selective abortion is very high. Women who think that abortion is legal, and they think that it's okay to abort a child if the fetus is a daughter. It's 9.9%, 10%, which is 7 points higher than the national average. And there's a huge son preference in the province. But if you look at why the last pregnancy was aborted among women who aborted the last pregnancy, you'll see that it's 16% of women had aborted their pregnancy because the sex of the child was undesirable. So there are, and this does not count the include the figures where abortion takes place in India. Nepal and India share cross-border, share an open border, and it's very common for people to go across the border to for abortion. So that this figure does not include that data as well. And there are similarly very like a big gender gap and very poor indicators in education and in early marriage. Also, the average age, median age of marriage is 16.5, while the national average is 18.1, and the legal age of marriage is 20. And there are similar gender gaps in participation of women in the labor market. So against this backdrop, the Madhya Province government introduced the Beti Padhao Beti Bachao program in 2019. We must applaud the government for this step. We must also be thankful to the donors. UNICEF, for example, who's supporting with we're supporting hugely on this program. So basically, the objective was to achieve social transformation and justice, and to eliminate harmful traditional practices such as early marriage, dowry system, and discrimination of girls on various fronts, and to enhance girls' education and empower them. It's basically working on stopping sex-selective abortion, stopping child marriage, working towards helping girls to stay at least up till higher secondary education, grade 12, ensure that girls are not married until they are 20 years of age, stop sex-selective abortion, and to ensure there's equal participation of women and girls in the labor market. So the program has basically, it has a lot of components, like 7 components, but the main 4 components are the girls insurance scheme, which is similar to what Anand sir shared earlier. So as soon as a girl child is born, she is enrolled in the program, she can be registered in the program, and after 20 years of age, and if she is not married by 20 years of age, and if she is not has completed her high school, she gets back the funding. Then there are components on awareness raising activities for girls' education, for ending other forms of discrimination, a little bit of funding allocated for digitalization and software for BPBP, because the program started with hard copies of document, but it has gone into a digital system now. Then there were some programs which provided bicycles for girls, but it was stopped after a while because of the lack of funding and some controversies. There were also other envisioned other parts of the program, such as laptop distribution for girls, scholarships for girls who achieve very high in the grade 10 examination, which is like not going consistently at the moment due to funding shortage. The other important part of program that is going is the Public Service Commission preparation. I saw that there's a lot of discussion on life course, social protection. So in this program, what happens is after the girl passes grade 12, they can enter into the Public Service Commission preparation course, which prepares the girls, which is a 3-month course that helps girls prepare into the public service, the government jobs in Nepal. So that it helps her to enter into the labor market. Just briefly on some of the key messages, some of the challenges. There's a funding gap of 90%. So, I mean, if you go look at the slide, the highest allocation is to the Girls Insurance Scheme, followed by the Public Service Commission scheme. But if we look at the funding gap, only in the educational insurance scheme, there is a 90% funding gap. So the present funding only covers 10% of the enrolled of the registered girls, which means that there's already a need for like financial support in this program. Then on the public service preparation exam preparation, the allocation per month per girl is only NPR 600 rupees, which has a serious implication on the quality. Like, if it's only 600 per month, what is the girl, like what quality training is she going to get? So that's thing. There are issues of coverage. For example, the public service preparation exam is only situated in the urban areas, and girls, there's high restriction in mobility of the girls in the province, but also because of poverty, girls cannot come and stay in the urban areas. And there are exclusion issues, for example, of children who are not registered because the parents, either of the parent does not have a citizenship certificate. That is also a very common issue in the province. The other challenge we found is the current model. Actually, if you have to reach grade 12, there's like a substantive informal cost involved, for example, in paying the exam fees or in getting stationaries for your for continuing the education, which comes to around 22,775. This is NPR. In the government school. So when we spoke to the girls, it leads to a substantive amount of girls dropping out of school. So this model, there is a problem in this model, and perhaps a space for other work to be done in reducing this challenge. There are policy gaps. For example, if girls decide to enter after grade 8, they can enter technical classes. So if they decide to enter the technical classes, it is not clear if they'll get to continue in the program. There's a lack of ownership and coordination. What we found was, for example, there's a 90% gap, but if the local government can cover 50% of the insurance, sometimes we checked with some of the local government, it is only 1.2% of the budget. But because of the lack of coordination and ownership, this is not happening now. There is no envisionment of space for other actors to participate in the program and to contribute to the program. And also sometimes we found that the beneficiary parents think that, the program, the money given at the age of end of 20 years is for marrying the girls and for putting it in the dowry, which is actually not the, not the objective of the program. So there's a bit of a challenge in helping parents understand the objective of the program. So I'm going to stop here in the interest of time. I'm very happy to answer other questions, but there's also other ongoing works from STAR. So for example, there's a roadmap being developed to looking at the opportunities and barriers to improving the strength of social protection system to end child marriage. This is happening in Nepal as well as in Zambia, where the Nepal team, Chaya ma'am is here. She's leading the team. She's exploring what needs to change for social protection to start fulfilling its potential for tackling child marriage and to co-create a flexible roadmap with key stakeholders in Nepal. I'll stop here. Thank you.
Thank you so much, Anita. This has been great. And do please post any other questions for Anita, because she's incredible resources and it will give you more information. And I think a lot of these questions, such as we've been seeing coming up, will be very useful. And we will hear how they've been addressed in different programs now as we turn to India. So we will pass on to Yoon Hee and Veena, our two UNICEF colleagues working in social policy in India, who will be presenting an assessment of the 8 girl-child cash transfers programs in India. Over to you, Yoon Hee.
Thank you very much, Jessica. I'm very pleased to join today together with my colleagues, Veena, Pooja, as well as all of the UNICEF colleagues in child protection, social policy, and SPC across 13 field offices, and especially want to acknowledge the presence of Ms. Sufia, Commissioner of the Government of Madhya Pradesh, Department of Women and Child Development, Ms. Pragya, Joint Director of WCD Department of Madhya Pradesh, who will be sharing more insights about the transformational potential of social protection for girls. Preventing child marriage, but to further empower them and really ensure that their lives are transformed. And I want to also acknowledge our National Ministry of Women and Child and Development for all of their efforts on prioritizing this as a flagship priority for the government of India. And just to let you know, we are sharing the insights of the girl child cash transfer programs of the government across 8 states. And this is a study that was supported by UNICEF in partnership with the Institute of Human Development and want to acknowledge the huge contributions of the STAR Gender TA team to review and provide inputs in our regional office of South Asia. And we have 8 schemes here where we have the oldest in Karnataka, as well as Madhya Pradesh. We also have all of the schemes, majority that focus on the life cycle vulnerabilities of a girl child, looking from 0 to 18. Some look even beyond the age of 18. And you'll notice 2 orange boxes. Some specific social protection programs led by state government with support of national ministry looks at the specific age category of adolescent and second decade. And for example, in West Bengal, a lot of cash plus, linking it with vocational skills and opportunities similar to the Madhya Pradesh program. And all of them try to address, the improving sex ratio at birth. It has a strong focus on education and health outcomes for girls, and also ultimately to prevent child marriage. And if you look at the key features of the design, in terms of eligibility criteria, it focuses on addressing the vulnerability of the girl child. In multiple states, it looks at income criteria. It has a specific focus on girls. As I mentioned, there is age categories and so forth. It is a conditional cash transfer, and it specifically links educational cash incentives to the condition that girls remain unmarried until the age of 18. So it really discourages child marriage. It also has, as I mentioned, looks at birth to adolescence. 6 states that we looked at, links it with birth registration, immunization at the early years, but it looks at second decade issues of adolescent and really looking at issues of menstrual hygiene, mobility issues, sports for development to improve their confidence and empowerment, skills development, and even providing economic activity. So we call it the cash plus. We have, and as I mentioned in the 3rd bullet point, there is a strong focus on education, health, and nutrition, and it requires a multi-sectoral effort, and all of the schemes and many of the schemes have multi-departmental effort from WCD to health to education and so forth. In terms of the key achievements, and this is just the highlight of 2023, based on the 8 states MIS, we had over 12 million girls and families that benefited from Girl Child Cash Plus programs. And in 2024, an estimated 16 million plus girls have enrolled into those state programs. And what have we found? Similar to the previous speakers, we've seen registration of birth of girl child has increased. So this is the first right of legal identity that gives a girl a right to social services, social protection, very foundational right has improved. We also see vaccination of girl child that has increased, and we see the role of Angawari workers, the frontline workers that are critical for both the birth registration and the vaccination. And this protects them from lifelong preventable diseases, really looking at early childhood development. And across the life cycle, we do see improved attitudes to our girl child value has increased. And you see girls finishing up to class 12th, high school. And conditional, cash incentives are linked to different age groups from, 6, 9, 11, 12, to ensure they really complete their education. And we'll see in the Madhya Pradesh case and others where we go beyond this, linking with vocational skills and opportunities for girls. And we see in the adolescent group, the transfer benefits goes directly to the girls' account. And the study through fieldwork has shown that money has been used for educational needs like uniform books. And we have seen from field work that there's less incidence of child marriages, few incidents of child marriage. So showing that there's a powerful case to be made to ensure that these such programs sustain over time throughout the life course. And in terms of challenges, the social gender norms are very entrenched. So there are very deep-rooted gender and social norms that we still have to work around. Communities, they're still reluctant to educate girls, them being in co-education facilities. There's also, sibling care burden that are still an issue that we really need to do more around SPC, community awareness, involvement, including involving men and boys to ensure that we really address the social gender norms. We have seen in some cases limited skills development opportunity for girls. So what next after their secondary education to ensure that their learning leads to earning and decent work? There has been some cases a lack of clarity in terms of what is the purpose of cash transfer. The strong focus on education empowerment and preventing child marriage. I think more can be done, and that was kind of the feedback from some of the informants. There is still high educational expenditure, so need to do more in terms of looking at the cash transfer values, for example. And then lastly, we need more orientation and systematic training around the frontline workers, and those all involved not only frontline workers, but all other departments. Let me now pass it on to my colleague Veena, who will go through the lessons learned and policy recommendation in terms of design and implementation. Thank you.
Thank you, Yunhee. In view of time that Sophia ma'am has a pressure to leave and very quickly. So based on the lessons, we have 7 key policy considerations that we are working at national level and across the states. The first and foremost is supporting state government to analyze gender risk and vulnerability through the life cycle to identify clear-cut pathways, identifying cash plus component to respond to theory of change, support strategic communication mostly aligned to social and behavior change needs, supporting last mile approach through Ladli clubs and through Kanyashri clubs and all, so that more women and more girls are brought into the program. And the last of all is cash plus monitoring. So cash transfer gets monitored, but to support MIS in a way where the positive changes can also be tracked. So with this, I will hand over to Sophia ma'am for her presentation, and then we can come back to our question answer. So over to you, Sophia ma'am and Pooja.
Thank you.
Thank you, Veena. I hope the PPT is visible.
No, not yet. Not yet.
Now?
Not yet either.
I can try to share it from my end if it's easier, Ms. Sophia.
Yeah, please do that. Please do that. And you have to exit as well.
And if you can just let me know to turn the slides, I'll do that for you. Over to you.
You have to exit. No, it's not. It's been shared by their. Okay, sorry about that. I hope the introductory slide is visible to everybody now.
Yes.
So, a warm welcome from my end. I am Sophia, who's looking after, as my current charge, after the Women and Child Development Department. And I would come straight to the topic that I want to do a presentation regarding the Ladli Lakshmi Yojana of Madhya Pradesh, which is about the girl child cash transfers. Next, please. Next slide, please. Yeah. To give a brief outline of how the scheme started and what is its coverage, we started nearly 20 years ago in 2006, that is 18 years ago, and we would be completing the first life cycle of 21 years for our very first entrance of the scheme by 2027. So the scheme started in 2006. It follows a life cycle approach, that is, we incentivize at every stage, at every level of standards of class achievement in the educational system, and it is paralleled by a small cash incentive at that level. The total coverage for this scheme is 4.8 million girls as of now, and the eligibility is like, the child is registered, the girl child is registered at birth or up to 5 years of age after birth, and the full maturity of the scheme, like any investment scheme, is 21 years. The target group is first two births if they are girls. So, though here we have written that the target group is first two girls, but the target group is that in the first two births, if there are any girls, one or both.
Apologies. I think Pooja will share the PowerPoint. It's the wrong slide. Yeah.
No issues. So with first two births, if they are girls, are covered under the scheme. Next, please. The objectives of the scheme were, as we had started out, to improve the sex ratio or make it more, more favorable for girls, improve the education of the girl child or the girl as such, discourage child marriage, bring about a change in the community's perspective towards the female child, reduce gender disparity, and also encourage family planning. So, these were the objectives when we started on 2006, and we've also mentioned some of the numbers that we have been able to achieve in these subsequent years. We would come back to these achievements in the subsequent slides also. Next. I had mentioned that there's a life cycle approach. We have incentivized the cash transfer according to the educational achievement of the girl child, so that we are able to retain the girl child in school for a longer and probably a longer period of time. And if you can see that we also mentioned that the Ladli Lakshmi Yojana version 2 was started in the year 2023. So from 2006 to 2023 was one scheme, which was the version 1. Then came the version 2 of the same scheme, where we have also incentivized college admission and ensured that, there's a subsequent payout of 1 rupees at 21 years. So college admission and incentivizing higher education came to a am I being asked to stop? I have a
No,
I think
you
I can
still continue. Please go ahead. Thank you.
Yeah. So, in the version 2 of the scheme, we incentivized skill development and education at the higher education level. 21 years is generally the maturity of the scheme period, and the child or the girl would be paid at 21 years only if we have ensured that the girl has not been married underage. So the promised amount or the amount which was on the previous slide, which is 1 lakh at 21 years, is conditional when there is no child marriage or no underage marriage for the girl. The very first amount, that is the 30,000 registration amount, is deposited by the government into a government corpus, whereby it then subsequently grows under the financial principles of interest, and this interest accrued is paid to the girl at different stages, and finally at 21 years if all the conditions are met. Next slide. I think there were some questions regarding the cash plus also, and how the Ladli Lakshmi cash transfers should also be focusing on value addition in terms of cash plus. This is definitely a very, very important aspect. It might not really involve more funds, but it definitely involves a lot of exercise at the department's end, and also all the other partners which are involved in the implementation of scheme, whether they are social sector partners like UNICEF and other NGOs which are working with us, and also other departments which are involved with us like sports, education, health department, and other such like skill training and vocational training departments are all part of it. I'm sorry about the disturbance. Yeah, so coming to Cash Plus, in the health and nutrition counseling, we have tried to involve girls at the Anganwadi level, in Lardi clubs at Panchayat and Anganwadi levels, whereby we have some 22,000 clubs for the age group of 14 to 18 years. And these girls are kind of trained into the empowerment dialogue or the gender equality dialogue through the topics that are mentioned below. How to how to engage themselves in sports and self-defense, how to find sources for online counseling for better vocational training and skill development, how to also through their clubs bring more largely friendly gram panchayats. Also, we have conducted exposure visits, albeit for not a very large number, but I think for the last 4 years we've been continuously carrying out these exposure visits, which is also goes a long way in training us towards better empowerment in the areas of menstrual hygiene and mental well-being. In both these areas, there is also a very notable effort that it is men who are being engaged more and more. The boys, the fathers and the brothers in the family are engaged increasingly when we do conversations on menstrual hygiene and mental well-being. Training programs have been conducted for digital and financial inclusion and digital literacy and financial inclusion. Next. So this is also, this is just a further elaboration of the Ladli Lakshmi Cash Plus scheme, where we have tried to explain a few factors, like how a certain conditionality results into its outcomes. If we look at it, that if we want that the girl should remain unmarried up to an age of 18 years, then it also ensures that she would appear for her class 12 exam, which would mean that she would at least do 10 years, at least 10 years of school education, or maybe also do 12 years of school education. And we also do cash transfers for the girl child at the middle school level and high school level. So, which means that there is a certain incentivization that the girl is likely to continue into middle schools and high school educations. Similarly, we see that this kind of a conditioning brings about social support, aspirations, attitudes, education tends to improve better. In terms of delayed marriage, also if you see, there is better educational awareness, better empowerment, there's a greater voice for women, and all the other gender related social changes tend to follow. Next. Since the scheme, next please, Pooja. Yeah, thank you. Since the scheme had been running for close to 20 years, it was decided at the highest level by the Chief Minister that a certain study should be carried out to see what is the actual outcome in this matter. So, or with the implementation of the scheme. So, a small sample study in 10 districts with a sample of about 4,000 families was was done with the help of UNICEF. And some of the important outcomes that were noticed in this was that basic gender equalities that should start at the school level had begun to appear. Like there used to be separate rows for standing waiting lines for girls and boys. That had come to a stop. So like now there was a common line for both girls and boys. If a particular teacher was approached by a girl student regarding any such problem, some such discomfort on such issue, then the teachers were found to be well sensitized and quite confident in handling these kind of problems or resolving the grievances of the children, especially if they were girl students. Also, we had initially had to fight a bias among the teachers. They too come from the same society, and they may reflect a certain bias towards the boy child. So the teachers were found not to be biased. They were found to be using gender neutral language when they were teaching, and any empowerment program or any counseling program, if it had to be conducted, the teachers were well equipped to handle it themselves. They did not need further support or further empowerment. So these are, I think, very important changes that have come about in social behavior. Then in the last two lines, if you see, there are two figures, 69 and 89. This is a percentage of awareness that the parents had. So like there were 69% parents who were aware that they do not want to let their girl child be married underage. So these are awareness numbers which have come up from a very small sample survey of 4,000 families. Then there were 89, or let us say 90% to round it off, 90% parents who did speak about their commitment for education of the girl child. So these two percentages talk about the improving perceptions among parents towards developmental or gender developmental issues. If we look in real numbers, which I've not mentioned on the slide because this is a sample study that is being mentioned, in real numbers, child marriage from 2006 to 2024 has declined from 57% to 23%, which is a very good decline, and we still have a huge target to go forward and meet. In terms of girls' education in 2006, whereas the average was 14%, now the average is 29%. So there definitely has been an improvement. But in the rural areas or among the poor, I mean, because the sample survey was conducted for the below poverty line families, there is a greater improvement that is required, but nonetheless, there has been improvement. Next, please. In the next slide, we have tried to explain how not just the Women and Child Development Department, but also the Health Department was equally involved. Their frontline workers are equally aware of the scheme, and when parents do come and ask about the benefits for the girl child, they are able to explain well. Next, please. Since I'm running out of time, I have to rush, I think. So this is some photo gallery for a visual support before I close. That we did form a large number of Lali clubs, whereby almost 250,000 girls are registered, and they are dedicatedly working towards a dialogue in gender empowerment. Next are just some photographs, and the last slide. Next, please. Here you can see how they are involved in, I think we missed one slide, but that's okay. They were photographs. Thank you. Hi,
Thank you so
yes.
much. Thank you so much, Ms. Sophia Wali, and thank you. I know that you will have to run off to another important meeting, so thank you for taking the time of presenting and sharing the program in Madhya Pradesh. I will now hand over to Shreyasha, who will be taking leading us through the question and answers.
Thank you, Jessica. Hi, everybody. Thank you so much for your presentations. We had some of the questions already from the audience, which have been responded by our speakers. I'll go on to ask the first question from Belete, child protection specialist at UNICEF. So the question is, since some of the cash support becomes available only when girls reach a specific age, such as 18 or 20 years, what other strategies can be implemented to provide direct, timely support to families? These immediate interventions could help address pressing economic challenges that might otherwise lead to child marriage before the age of 18. It would be useful to hear insights from our speakers on social protection programs that could both improve current living conditions and encourage girls to stay in school and remain unmarried till they turn 18 to 20 years, when they will be able to access the transfers. I'd like to invite Jessica, if you could kindly share your insights on addressing the economic barriers.
Okay, thank you, Shreyasha. And I will let also my colleagues complement from their experience. Just to say that we do know that it's a very important question, that we need to also address some of the economic and poverty issues that are that the families face throughout their life cycle. So not just at the end, and see how we can support them on an everyday basis. We do know that when we give regular cash transfers on a regular basis, predictable, on a long-term basis, that these have incredible impacts on on many outcomes, including for children, for the girls, for the women, on meeting their daily needs and basic access to services. So I think this is really important to think, how do we complement between having an incentive to keep the child in school for longer term and getting that incentive when they grow to be 18 or 21, but also providing that child and that family with some regular incentive, regular cash transfers that can help them meet those basic needs. So I think this is really important. I do want to maybe invite my colleagues if they would like to complement too, because we do have our colleagues from our government, Mr. Ananda and Ms. Anita from Nepal, as well as our colleagues from India. So please do come in. Yes, Ms. Anita, go ahead.
Thank you, Jessica. I have answered like in the chat box as well, because the questions were posted there. But I think from the examples of Nepal, what we can see is linking families to the other unemployment social protection program. For example, in Nepal, we have the Prime Minister Employment Project, which gives 100 days of employment to families who register as unemployed. But I think the bigger question is also normative, because see, they want to marry a son when he's 20 years of age, because a son is seen as someone who will contribute economically to the household. So they still invest on son's education, which means that like changing this narrative that a girl child can also be an economic contributor to the household is also, I think, important. So having an economic support program is important, but also a normative change where family sees girls as potential economic contributor to the household after getting an education is also important, I think. Thank you.
Thank you, Ms. Anita and Jessica. Veena, I see your hand up, so would you like to elaborate more?
Thanks, Shresha. Just 3 strategies for India that we are pushing at national level and also at the state level. And government is pretty much on board. And as you have heard, Ms. Sufia, so this bringing skilling and employment as critical part of Cash Plus has been one of the biggest strategy that UNICEF is pushing forward, with also linking with UA program, which focuses purely on economic opportunity and employment. So this is one of our major flagship strategy. Other one is leveraging creches and cash grant, because a lot of these girls are retained at home to be trained as a future bride and share a lot of care responsibilities at home. So we do see that our advocacy and support to government to implement care services does provide and absorb these girls to continue in their education and in school, and participate in other activities, while their mothers and other women in the family can get more productively engaged in economic opportunities. Care grant has been something new. It's not termed as a care grant, but there has been recent lot of initiative in India, in Maharashtra, in Madhya Pradesh, in West Bengal, where Lakhi Bhandar or Ladli Behna or other schemes that covers women in reproductive age group, providing partial compensation of wage and nutrition that is provided as a part of in lieu of the care work that women are doing. The third strategy which I would like to highlight, which we are working closely with government, is linking these families with 2 major programs. One is National Rural Employment Guarantee Scheme, and another is National Rural Livelihood Mission, where the access to microcredit and other facilities will also be potentially extended. And girls are also given, once they pass class 12th, they are encouraged to opt for various loans like Mudra loan in India and other kinds of loan to do businesses and other kind of thing that they want to do. So these are 3 strategies. These are shaping up, but we do recognize that economic support and income support to families are critical. Cash Plus are critical, and as Anita mentioned, social behavior change continues to be the integral part of our communication and support to government. So thanks a lot. Over to you, Shresha.
Thank you, Veena. With the keeping time in mind, I'll just ask one more question, perhaps for our speakers from India and Nepal in terms of, I think a lot was brought on about multi-sectoral engagement and linking cash transfer with different services. Could you elaborate a little bit more on overcoming governance issues, especially in terms of coordinating with different sectors? Just like to hand over to our speakers if anyone would like to elaborate more on this. And then we'll be moving on to our closing session.
Sufia ma'am and Pragya, will you like to comment on this?
We saw.
Yeah, thank you. Thank you so much, Jessica. I just wanted to share that, Cash Plus initiative has taken a very leap and bound here in Madhya Pradesh, and the girls are doing very well. Pragya ma'am is with me, and she presented in Kathmandu. And if you want to add one or two line on to, because she's been looking.
She's already done. Hello, Jessica and all. Veena ji, hello. Yeah, actually, I gave a presentation in Nepal and explained everything there. And we just had we just listened to our commissioner who is looking after the scheme. And as Pooja has told you, this scheme has really done so well that we have really increased in so many parameters, human development indicators like child marriage, school education, and others. So I think we have already explained it. Thank you.
Thank you, Pooja. If any other of our colleagues would like to come in. Yes, Veena.
Isha, I've just added one of the biggest, I just couldn't resist to come in, like Pragya mentioned, Samagra Social Registry was something that where we brought this Ladli Lakshmi scheme on that. And that has resolved lots of governance bottleneck. That is what was your question in terms of bringing different department and multiple services together and also reaching every girl that are targeted. So that has been one of the game changing in terms of improving financial efficiency, transfer of cash transfer, and also bringing more greater convergence and using the platform to monitor the greater convergence across the department and ministries. So thank you, Shreyasha.
Thank you, Veena, for highlighting about integrating different systems, including information systems and different department together to increase efficiency for the implementation. In the interest of time, I would like to maybe hand over to Jessica for closing remarks.
I think we have a few minutes. Maybe Anita, I saw your hand. Would you like to come back in for a few minutes? We've been allowed to go for 2-3 more minutes, so please.
Okay, thank you, Jessica. So what we saw from the study in Nepal is that, for example, like in the Public Service Commission, where entrance preparation exam, where we said that there's only 600 rupees per girl for 3 months. So that's very less. So what we thought was integrating that system with the National Public Service Commission exam, where they can give the modules and online. And when we talk to the local government were very happy to provide the infrastructure. They said that they are happy to give a space for classroom for these girls, put a TV for the girls, and have an internet installed, which means that all the girls can actually come to the local ward office to have that exam. So I think coordinating with the local government would be a huge additional resource in place where there's a lot of scarcity of resources in the program. The other thing we worked out was we took example of one of the poorest province one of the poorest local government in province 2, and we found that even if a small percentage of budget is put as a 50% contribution, which they are already putting for women and girls under different headings, so that can also cover the gap, because as I shared earlier, there's a 90% funding gap in the insurance scheme itself, right? So if we work with the local government to ensure that they put a little bit of their fund into the program for at least like 50% coverage, ways, that I think already covers a lot of, like, a lot of the funding gap in the program. So I think coordination would really, like, looking into where we can coordinate, giving space for all the donors to chip in. For example, in the bicycle program, a lot of donors are happy in the in extending their support to the bicycle program. So I think both intergovernmental coordination, but also coordination with the other actors who work on child marriage and social protection would really, like, support the program.
Excellent. Thank you so much, everybody, for all of your contributions. And thank you, Shreyasha, for leading us through this. And I'm really glad that we did have a few minutes to be able to answer questions that came up. I just wanted to wrap up with this last thought, because I think it's one of the key things is what we've been seeing from all of these examples is how we can link with different services between cash transfers and other services, whether it was social behavior change or nutrition or education or livelihood programs or trainings, and that all of these address different of these like drivers of inequality and of poverty and other areas. So I think it's really important to look at it in this comprehensive view. We have challenges, and I think to recognize we will have challenges, and some of them are governance challenges. What we've seen in several places around the world is having also somebody who leads this, really a leader that brings all of the entities together does help a lot. We have also building on existing platforms, so nutrition committees that are already cross-sectoral also helps to reach the different, bring the different sectors together. We've also seen that, for example, using the community level platforms in India, maybe self-help groups in here in Nepal, mother help groups that support bringing the different communities together who know exactly what is happening and can bring and attach. We also know in some countries that the social workforce is key in supporting these referral systems. We are also turning to also very much to these information systems that help us connect and identify where different services are and which households need the different services. So there are various examples, but those are the hardest to do in the sense of when we talk about coordination is how do we implement it to make sure that we can really address the different risks and vulnerabilities that these girls and women face. And I thought the last point to say that I think it was really incredible to see in several of the programs that how important it is to engage with the community, to be able to get that acceptance, that buying, and that change that goes beyond just the girls. We're looking at the men, the community leaders, all of them to be engaged, to be able to see that change that we're looking for. So I wanted to just thank first our speakers who have made time to prepare the presentations, go through many of the discussions, and share here all of the lessons and information that is available, that is coming out of these experiences. I wanted to particularly thank our government officials that have made the time in very busy schedules to share how they've been able to advance this. And it's a trial and error, and they're trying and they're making efforts, and we can see already very many positive outcomes that are coming out of these programs, even if there's still challenges that lay ahead. So thank you again for everybody. And we, as we said, we will be sharing all of this on the socialprotection.org webinar, and we're looking forward to continuing this discussion.